She
The
will be
efficacy of eye
yes.
water compared to the index finger for upper eyelid eversion. Eversion of eyelids is a common procedure done as a part of a routine ocular examination. It is performed by the help of the index finger and the thumb of one or both hands. It can also be performed with the help of cotton buds. The principle behind lid eversion consists of the combination of two forces: pulling force by the finger on the eyelash and pushing force with the fingers on the upper tarsus. Lower lid eversion can be easily done by pressing the lower lid margin or with the help of a cotton bud, but the exposure of the superior tarsal plate is difficult due to the stiffness of the tarsal plate. Eversion of eyelid is essential for patients with acute redness, foreign body sensation, for the conjunctival disease, contact lens wearer, and for lid inspection. It is a skill that varies and especially difficult in anxious and distressed patients. With the advent of the COVID-19 era, there's a potential risk of transmission of virus due to the exposure of the ocular fluids such as tears or conjunctival secretions from the examiner's fingers to the patient's ocular bare surface. iVerter is a cost-effective, innovative, do-it-yourself, non-contact lid eversion tool. The materials required to make is scalpel, coffee stirrer sticks, and double-sided tape. So you can see in the video how we are attaching these coffee stirrer sticks at one edge over the double-sided tape, and then we'll be cutting each of them with the help of the scalpel, and in this way we can see how easy it is to make and to use it. The video shows the application. We place the eye water at the margin of the lid and we just twist it, and we can see how beautifully it can expose the upper tarsal plate. The aim of my study was to compare the efficacy of both the methods, namely the routine index finger and the iVerter tool based upper lid eversion, and also to compare the infection transmission possibility between the two methods. Materials and methods were: it was carried out in a tertiary eye care center. Ethics committee approval was taken. A written informed consent was taken. We took patients from age 18 to 44 years, and lid pathologies and lid swellings were not included in the study. The participant's head was placed against the chin and the headrest attached to the slit lamp. The left upper eyelid of all participants underwent both the techniques to avert the lid in a random order by the same trained clinician, involving the index finger and the iVerter tool for lid eversion. A Google form was filled for the same. The name of the patient was registered along with the age, the gender, who is examining it, doctor or paramedical staff, the date. We asked the patients how comfortable it was, from very uncomfortable to very uncomfortable according to the visual analog scale. Then, was the procedure painful, from no pain to unbearable pain? Was the procedure comfortable for the examiner, very comfortable to very uncomfortable? And the time required was recorded with the help of a stopwatch for both the methods, and the number of trials required for successful lid eversion was also recorded. And we asked the patient and the examiner which would be the preferred method, and also the examiner was asked the same question. A culture swab was taken from the fingertip after both the finger based and the iVerter technique to assess the growth of microorganism. So the results showed that the iVerter was a little more comfortable for the patient compared to the finger-based lid eversion. It was shown that finger-based lid eversion experienced little to mild pain, while iVerter mostly was no pain. The examiner preferred both the techniques equally. The time required was a little more for the lid eversion by the finger-based. The mean age group was 24.6 a year, and the gender was male were 40%, females were 60%. Patient comfort wise, iVerter was better. Finger based technique experienced no to mild pain. iVerter and finger based were equally preferred by the clinician with regards to comfort. Time required was was more for finger based. Trial requires were more for iVerter. iVerter was preferred more by the patients. Finger based technique was not preferred by the clinician. Microorganism growth was seen more for finger based technique. There was no statistical significance seen with regards to the comfort, time, and the area exposed. And IVERTER, the limitation was that every finger has a different thickness, because it becomes difficult to evert lids with the finger. Fingers are more cumbersome also because disinfection is more difficult. And lid eversion took only less than 8 seconds with the help of IVERTER. So questionnaire also was given and shown that IVERTER was preferred. And the number of trials were more for lid eversion with IVERTER as seen in the questionnaire. Conclusion was that IVERTER was equally efficient as lid eversion by fingers, but also more safe during the COVID pandemic, wherein there's a risk of transmission of infection, and also the patient experienced minimal pain.